The Visiting Nurse Association of the Inland Counties is celebrating 80 years of continuous service to our patients and their families and the communities in which they live. That means we were seeing patients before Medicare, before Medi-Cal, and certainly before managed care. Our early years in the city of Riverside were predominantly well baby calls and support of those dying at home. But whatever the year or place, the VNA was doing then what it still does today, providing professional, compassionate care and support for patients and their families. Through these past 80 years, VNAIC has been providing this care for patients regardless of their ability to pay, their living conditions, or the location of their house. Our patients are seen in their own homes, the homes of families or friends, or in some cases in facilities, wherever a patient considers home to be. The year was 1928 when a group of young women in the city of Riverside had the courage and initiative to form a group dedicated to community service. At the request of Mrs. Theodore Childs, Julia Walker's mother, the group started by raising some money and set out to discover what community service was most needed. The first thought was a child care center for working mothers. To this goal, they raised money in earnest, selling candy at hospital garden parties, holding parties and dances, and in 1929, they began the Junior Aid Bazaar, which continued annually until 1959. By 1930, they had earned and invested $3,450 and engaged Dr. G.B. Mangold of the USC Graduate School of Social Work to conduct a research project to identify the community needs of the city of Riverside. He recommended a visiting nurse program. This group of community-minded women formed the Junior Aid chapter in Riverside, which today is known as the Junior League. And in 1931, they established a visiting nurse service. This group of women hired the first nurse, Mrs. Marie Berkelou, and with volunteers from the Junior Aid, opened the office in the Fox Theater building. It was 6 years before a relief nurse was hired and college girls employed for secretarial work. The Junior Aid volunteers also provided the marketing by visiting PTA meetings, doctors, and office nurses to inform them about the visiting nurse service. In 1948, the Visiting Nurse Service became the Visiting Nurse Association, and the Community Chest, today known as United Way, assumed partial support. A report done in November of 1948 noted that the VNA was about to begin its second year as a Community Chest Red Feather agency. The report said that this second year, 1949, promises to be an even busier and more expensive year than ever before. With higher rents, increased salaries, and inflated economic conditions, the VNA was forced to increase its 1949 budget by several $1,000s to $17,000. This $17,000 paid for 4 full-time nurses and several part-time nurses on call, averaging 505 bedside calls per month. Of those 505 calls, 40% were full pay at $2 a visit. 50% of the calls were at half pay, and 10% were provided without any charge. A written report notes, during the war years, there was less free nursing service than there is today. Non-pay cases are again on the upward trend because money and employment are not as plentiful as before VJ Day. Substantial money was raised to support the VNA by Junior Aid and the Community Chest, which was accomplished with a sense of pride and community service. The 1948 report also encouraged more visits. It said, perhaps you have already met the visiting nurse. If not, keep her in mind this year if sickness should arise in your family. She is a comfort indeed to patient and family alike. In 1951, the VNA presented a new slogan, a visiting nurse for every purse. 1961 brought the VNA's 30th anniversary. It was at this time that funding was becoming available from other sources, such as the Arthritis and Rheumatism Foundation, the American Cancer Society, the Permanente Medical Group, as well as government programs like Aid to the Needy Blind and Aid to the Totally Disabled. By 1964, requests for service were coming in from throughout Riverside County. The VNA was now providing nearly 1,000 visits per month. July 1st, 1966 was a day to be remembered for the VNA. Medicare became effective. Notes of that time reflect a concern on how this would affect the agency. New rules and regulations must be followed. To be paid by Medicare, the VNA must furnish an additional therapeutic service. There will be an increase in the post-hospital nursing, and the director must be a trained public health nurse with administrative experience. More services will be required in the future: physical therapy, home health aides, occupational therapy, medical social work, and speech therapy. Service requests are now coming in from Palm Springs, Palm Desert, Indio, Corona, Hemet, and Banning. Notes from the VNA's Trend Committee stated, "We must export our know-how and skill to these new areas. I see a board and staff faced with a challenge which they are more than adequate to handle." 1966 showed many changes. New headquarters on 11th Street, new director Nancy Bazier. Current visit charge is $6.50. Corona Norco will be served, and Sun City has sent in a contribution of $1,700. In response to the growing need throughout Riverside County, the VNA opened its first branch offices, Palm Desert in 1968 and Hemet in 1969. By 1970, an advisory committee had been established in many areas of Riverside County. And to show how little has changed from today, the board notes of 1970 stated, "The Medi-Cal program for welfare cases set maximum fees below cost." The VNA sets up a cooperative homemaker service with the welfare department so that the staff can go into homes to assist with chores and personal care. In 1971, the VNA was working with the State Department of Health, who noted some issues the agency had with continuity of care, lack of personnel to handle publicity, unmet nursing visits, and needed a board of directors who represented all the communities served. This is the year the Junior Aid stepped aside and discontinued its support. According to records from the Junior League, they had contributed $77,331 to the VNA since 1930. Wow. Remember, much of this money was raised by these dedicated women with dog shows, plays, dollhouse displays, a nearly new shop, and it is reported that there was an appearance by Will Rogers to benefit the VNA. By 1976, the VNA was receiving many calls for service from San Bernardino County, so the Board of Directors changed the name to the VNA of the Inland Counties to reflect service in both areas. Soon after, the VNAIC opened offices in Yucca Valley, Corona, Yucaipa, and Blythe. From 1977 to 1985, the VNAIC was moving its offices in response to the needs of patients and the staff who served them. Offices in Yucaipa, Redlands, and Corona were opened and then closed. Offices in Victorville, Barstow, and Sun City stayed open. A partnership was formed in 1987 with Valley Health Systems and Hemet Hospice to incorporate Ramona VNA and Hospice. This nonprofit VNA assumed two of the VNA's offices, one in Hemet and one in Sun City, and is still in existence today. The VNA is no longer a partner in this venture, but considers them to be a sister VNA with its foundation at the VNA of the Inland Counties. 20 years following the original Medicare legislation, Congress added a new benefit to the Medicare system: hospice. Hospice became final in 1986, and VNAIC assisted Ramona VNA and Hospice in its certification, and then in 1989 established VNAIC's first hospice program in Victorville. By 1994, all branch offices had a certified hospice program, and they are still in place today. The VNA has been led by a strong group of administrators over these 80 years, and it is because of their vision, hard work, and dedication that we are thriving today. 1931 to 1950, Marie Berkelou, RN. 1950 to 1951, Mamie McCadden, RN. 1951 to 1966, Ruth Munson, RN. 1966 to 1970, Nancy Bazier, PHN, RN. 1970 to 1975, Irma Heckman, PHN, RN. 1975 to 1978, Mae Jean Howard, PHN, RN. 1978 to 1986, Harold Kokendorfer. 1986 to 1990, Linda Black, Registered Physical Therapist. 1990 to 2011, Lynn Campbell, MSN, PHN, RN. On February 1st, 1981, the VNA celebrated 50 years of service, and Mrs. Doris Grubbs, past board chairperson, said, As I reviewed the records from the past, I think the single feature that impressed me the most was the outstanding groups of people who took leadership roles in the organization. The conviction and dedication of leading citizens from throughout the county who met the challenges as times changed and new needs arose to be faced and met. How it was kept a volunteer organization when it could have easily been turned over to a tax-supported agency. I hope the next 50 years will show increased service to our rapidly growing city and county by our Visiting Nurse Association as they met the opportunities for service in the past. As the Visiting Nurse Association of the Inland Counties continues to grow, our unique history will be the foundation of our future success.